Hi everyone, this is Ted Bauman here, editor of the Bauman Letter at Banyan Hill Publishing. For the last couple of weeks, I've been putting out videos on the topic of economic competition in the United States. I've talked about some of the theory behind it, why uncompetitive markets are a problem. I've talked about some of the ways that it distorts our economy and our politics. I've talked about how some of the fortunes that have been earned in the US economy are not really based on innovation or being good at business, but rather being good at setting up toll booths and extracting money from our pockets. Now, I have told you for the last couple of weeks that my first detailed look at an economic sector would be healthcare. Now, when I started working on this issue, I realized it's too big for one video, so I'm going to split it into two. This week, I'm going to talk about the performance of the US healthcare sector, as well as its relative level of cost compared to some of our peer countries. It's going to shock you. You may have seen or heard of some of this information in bits and pieces. Maybe you even have read some of the articles about it. But what I've tried to do is to bring together impartial statistical information that shows both the cost structure of the US healthcare system as well as its performance relative to our peers, namely the other wealthy countries in the world, in Europe, Japan countries, Australia, countries like that. Now, what you see is going to shock you, but I guarantee you this is not stuff that I cherry-picked. It's the basic facts of the matter, and it is going to be disturbing, but I think it's important to understand what the situation is doing to us before we start talking about the specific reasons why it's like this, which I'm going to address next week. So let's look at the slides. Here we go.
Now let's start with a chart that shows the relationship between life expectancy in the United States and life expectancy in some of our peer countries like Australia, France, Canada, the UK, and so on. As you can clearly see, life expectancy at birth in the United States kept track, more or less, with our peers up until about 1980, after which we began to decline. Life expectancy continued to increase up until about 2014. Now, this chart goes up to 2015, but it has continued to decline since then, particularly for people in the middle class. Now, the next slide shows the cost of healthcare in the United States versus other countries. And as you can clearly see, despite the fact that our life expectancy here in the United States is declining, we spend considerably more per person in the United States on healthcare in terms of GDP than almost all of our peers. In fact, we spend just about twice as much as the average for our peer countries. Now, the composition of that increase in cost is important. As you can see, the increase in the United States cost has risen quite dramatically relative to our peers. But here, the next slide shows you how that cost increase has been allocated. Now, as you can see, in the United States, the cost of private sector healthcare spending is nearly triple that of comparable countries. What we spend on public healthcare, which is things like Medicare and Medicaid and other forms of publicly supported healthcare, is about on average with other countries. But the private costs of healthcare are way out of line. That's what drives the rapid increase in healthcare costs here in the United States. The next slide shows again that in terms of the public expenditures on healthcare, the United States has been more or less in line with our peers. That's the light green line. Our peers are the pink line. But the cost of U.S. private healthcare has risen way faster than any other of our peer countries. And again, that is the source of the increase in healthcare costs in the United States, the private healthcare system. Again, you can see that if you look at the private cost per person compared to the public cost per person in the United States compared to Switzerland and Netherlands, it's about the same. But the cost of private healthcare is just astronomically higher in the United States. Let's look at a couple of common procedures. Hip replacement, almost $30,000 in the US, a little less than $18,000 in comparable countries. Knee replacement, $28,000 in the US, $18,000 in comparable countries. Appendectomy, that's an interesting one because it's almost 3 times the cost of, in the United States, the cost of a comparable country. So fundamentally, the issue here is that right now, the cost of things like MRIs, here's a graph showing that, all kinds of things in the United States. Pharmaceuticals, you can see here in pharmaceuticals, we pay far more per person for pharmaceuticals, leading to a tendency for Americans not to be able to afford to take their medications, which is twice as high as our nearest peer, which is Canada. All of these things lead to this dramatic explosion of expenditure that is not matched by any kind of performance results in terms of our overall healthcare system. Because as I showed you at the beginning, our life expectancy is actually declining. Now, let's look at one of the major drivers of costs. In the United States, the administrative costs of the healthcare system, in other words, what we pay for things like billing and insurance, all those things that Joe Biden spoke about the other day in the speech where he said we'd lose 2 million jobs if we changed the healthcare system. Well, we're paying $500 million just for the administration of healthcare in the United States. That is really extraordinary. $500 million a year just for billing, insurance, etc. Now, if you look at the share of healthcare spending on administrative costs, again, we are way out of line with our peers. We're spending huge amounts of money on administering the healthcare system, things like insurance billing and pricing and all that sort of stuff. Again, here you can see the relationship between the total administrative costs and the billing and insurance related expenditures for different kinds of medical companies. For example, physician groups spend 13.9, almost 14% of their administrative costs, their total costs on just billing and insurance, right? Hospitals, nearly 9%. So the message here is that the United States is way out of line with the rest of the world, not only in the cost of insurance, or healthcare rather, not just in the lack of performance of our system in terms of keeping us alive, but also cost. I mean, here you can see that the average inpatient surgery, the administrative cost alone is $215. Surgery that might mean a visit to the hospital that you leave the same day, $170. So that's money that's coming out of our pockets and going to pay for the massive overheads of the insurance industry. Now, here's something else that I think is quite notable relative to all the costs that I've just showed you. In terms of our ability to see a doctor, the number of times that Americans actually get to see a doctor, it's way lower than most of our comparable countries. Sweden is an outlier, but essentially almost everybody else in our peer group visits the doctor more often than we do. And one of the biggest reasons for that is because visiting the doctor in the United States is so expensive. And one of the reasons it's so expensive is because of those incredible administrative costs. It's also because of our insurance system with its high deductibles. The bottom line is people don't go to the doctor here, which is one of the reasons why we have such bad healthcare outcomes. Now, when people go to the hospital here in the United States, they tend to stay for shorter periods than most countries. And again, that's related to the high cost of it. If we look at how quickly we can access a doctor, basically, about half of patients say they can get a next day or same day appointment with a doctor. Most of our peer countries do significantly better than that. On average, nearly 60% of people in other countries can see a doctor quickly. So we're not too bad on that score, but the biggest issue is how much we pay once we get to see the doctor. Now, one of the consequences of this perverse system, where it's so expensive that people limit their visits to doctors, is that people in the United States go to emergency rooms for care almost more than any other country. Canada is an exception because in Canada, their healthcare system actually encourages people to use emergency rooms for routine things that are not necessarily emergencies. In the United States, though, people just go to the doctor, they wait until they are sick, at which point, if they can't pay, the government has to step in and essentially pay the cost of their emergency room healthcare. Which means that although we see the costs of healthcare in terms of things like Medicare and the taxes we pay for that, what we don't see is the hidden costs in terms of paying for people who go to emergency rooms because they can't access proper healthcare. Basically, we have higher levels of error in our medical system as well. Even though we're more expensive and we spend so much on admin, nearly 1 out of 5 medical procedures or medications or lab tests results in an error. That's pretty extreme. Now, some of our peer countries are not doing too well either, like Sweden, but in general, it's significantly higher, again, than our peers. Now, what does this come down to in terms of the outcomes? I showed you at the top of the slide that our life expectancy was lower than any of our peer countries. But something called the Healthcare Quality and Access Index, basically, what it means is that in terms of deaths that could have been avoided if people had good quality healthcare, the United States ranks dead last in terms of the OECD countries, the peer countries in our group. This slide shows that the disease burden in the United States is higher in the US than in comparable countries. In other words, this measure shows the life years that are lost as a result of every 100,000 people that are lost as a result of disease and the burden of disease. And what that means is that it's not just about mortality, it's about the quality of life and about how much we actually lose in terms of quality of life, in terms of years that we could be spent working and contributing to the economy as a result of this disastrous situation in our healthcare system.
So there you have it, folks. It's a sorry picture. But the reality is that the United States is by far the most expensive place in the world for healthcare on a per capita basis. As a percentage of GDP, we pay more for almost every kind of medical service than almost every other country in the world. And the main driver of that expense is in the private healthcare sector. In other words, where we go when we, for example, are using our company insurance to have procedures done. It's not coming from Medicare. It's not coming from Medicaid. It's coming from the private sector. Now, I'm going to talk about why that's the case next week, but I think it's important to realize that this is a very human issue. While I was researching this series, I came across something that just blew my mind. 42% of people in the United States who contract cancer end up losing all of their assets, everything, as a result of the cost of treatment. That's even if they have insurance. 42%. That is unheard of in the rest of the world. And at a very human level, I think it's important for us to consider just what that means. We as a country are failing ourselves by not dealing with this issue. It's not necessarily a political issue. It's just an issue of basic morality towards each other as residents of the same great nation, the United States. So next week, I'm going to be talking about the specific drivers of these costs. I'm going to be talking about what parts of the healthcare sector are causing these crises, or rather these costs, to be so high, and how they resist changes that could actually reduce this cost and bring us into line with the rest of the world, improve our outcomes, and stop putting people on the street simply because they get sick. Now, I think it's important to recognize also that one of the ways that we can try to prepare ourselves for these issues is to have a good income. And that's why I would encourage you to look at the description under this video and go down to the link that introduces you to my particular newsletter, the Bauman Letter, which is a publication of Banyan Hill Publishing. It's a subscription newsletter, and it introduces you to investment ideas that can help you to, in a sense, pad yourself and your wealth, try to create a little bit of padding to protect yourself against a future where you do have potentially these kinds of crises. So please consider subscribing to my newsletter, and also tune back in next week when I talk about the specific things that are making healthcare the disaster that it is here in the United States.